Hi to my Medshield clients, this is Hester Baileyveld. Welcome to the 2025 Premium Update and Benefit Change video. There aren't any huge changes for the coming year, so let's dive right in. Just some Medshield facts. First of all, Medshield is a self-administered fund, and this means it can keep control on non-medical related costs like administration, for example. It was established in 1968. It has a 63% solvency ratio, way over the minimum of 25 that is required. It has 2025 weighted average increase of 9.6, but it does vary according to plan. Selected benefit increases have been increased by around about CPI. An AA rating with a positive outlook, so they are considered to be a stable company. You only pay for 3 children per plan, and there are 3 plan exceptions to this. And then MediSwift, for those of you who might be on MediSwift, this has been cancelled going forward. There wasn't a huge take-up. Right, Medicurve is designed for healthy members who are happy to interact with healthcare professionals digitally. Normally this would be the younger crowd. Hospitalization is unlimited for PMB or prescribed minimum benefits, but there's also cover up to $1 million for non-PMB conditions, and this is a great introduction and makes hospitalization more comprehensive than many of its competitors. It is a unique benefit. New Medshield Specialist Network is now being introduced for 2025. Please call into your GP, get a GP referral if you require you need a GP referral, and please make sure that you go to one of the specialists on the new network. Otherwise, you're going to be penalized. There's emergency dental treatment and pulp removal and amputation of teeth. This is a new benefit, and I had no clue what amputation of teeth meant. It's where there's a single root canal treatment in a multi-root tooth. There are new benefits for 2 visits per family to casualty. Please, it's only the facility fee, not anything that you might have done there. Over-the-counter medication is the limit for the day has been increased to 250 and a total limit of 500 Rand per family per annum. Acute meds limited per family. So if you're a member only, it's 6,500 Rand and more as you go with more beneficiaries. You get your script from your nominated GP, and good to know that the basic formulary has also been removed. Maternity, there's 2 times 2D scans. There's amniocentesis or an NIPT to pick up fetal abnormalities. Oncology, there's a PET scan per family per annum. There are depression meds of 5,600 per beneficiary per annum, and that's not necessarily bipolar, it's actually monopolar, so just the normal depression. Interventional radiography is an excellent new benefit, CTCA, called computer tomography coronary angiography. I'm going to explain a little bit more later. It's a real mouthful. There's the specialist referral I keep referring to. Please, you must get your GP referral to it, otherwise there's a 20% copay, and if you don't go to a network specialist, there's a 30% copay. Alright, there's a new copay for day clinic extraction of wisdom teeth of 1,800, and elective Caesars now also have a copay of 10,000 Rand. Remember, if you're on GAP, those will be handled by the GAP. Right, MediPila is a capitation plan, but uniquely with Medshield, it does not use income brackets to determine the premium. You can be earning 50,000 or 5,000. If this suits you, you can go onto it at the same premium. New medical specialist network has been introduced, as I mentioned previously. Trauma casualty, there's 2 per family, and it's only pays for the facility fee. What's really nice though, there's no restriction of when you can go to casualty. You can go at 10 in the morning if that's when the accident or whatever is going wrong occurs. There's acute medication, increasing obviously the more dependents are on the scheme. You just get a script from your nominated doctor, and the nice thing is that the basic formulary has also been removed. Over the counter is now 500 Rand per day, limited to routine meds, and there is maternity 2 times 2D scans, mental health medicine of 5,600 for non-PMB. So bipolar is a PMB, but normal depression is a non-PMB. So you can get assistance there for mental health medication. Oncology, only for PMB, but you now get one PET scan, which is to check the cancer lesion, and that's been introduced. And the CTCA imaging has been introduced. Mammogram is one per female beneficiary above the age of 40 every 2 years. And then the childhood immunizations have been expanded to link or align with the Department of Health. So you might see more immunizations that have occurred there. That was brought in 2024. Okay, day clinic for wisdom teeth extraction. There is a copay of 1,800 Rand. Right, MediValue Prime and Compact. Compact being the network option, is a traditional plan, which means that there's no medical savings that roll over to the new year, but there is a day-to-day savings which needs to be used during the year. New medical specialist network has been introduced. If you don't get a GP referral, there's a 20% copay, and for non-network use of specialists, there's a 30% copay. So please follow the rules and you'll save yourself money. Casualty trauma, there's 2 visits per family at any time. Facility fee only, please. So if you have anything done in casualty, it won't be paid, like a drip or a scan, something of that nature. Maternity, there are 2 3D and 4D scans and 1 amniocentesis or NIPT, which stands for non-invasive prenatal testing. This is where the placental cells are in the mom's blood, and they can use those to identify if there's anything wrong with the fetus. Over the counter is 1,000 Rand per beneficiary per day, and it limited to day-to-day benefit. Mental health, non-PMB, so that could be normal depression, for example, 5,600 Rand. Oncology, there's a PET scan of 1 per family. New radiology benefit, the CTCA, I'll explain that more in future slide. Childhood immunizations have been upgraded to fall in line with the government health EPI program. This was introduced on the 8th of May 2024. Day clinic extraction of wisdom teeth. There's now going to be a copay of 800 Rand, but remember, if you have gap cover, this will be incorporated into your gap benefits. Right, Medicore is a hospital-only plan. Changes include the new maternity test, mental health medicine, prosthetic external devices, new interventional radiology, Medshield specialist network, where if you use the network specialist, you avoid a 30% copay, and please remember to get a GP referral. Right, MediPlus is a more comprehensive plan and includes many more benefits than the MediValue. Changes for 2025 are the casualty changes as mentioned previously, new maternity benefits, but here the selection of tests and procedures has just been increased. Prostheses and devices have been improved. Again, the interventional radiology, the DBC program has been introduced. This is a fabulous program developed in Finland, where anyone who's wanting to have an authorization for back ops needs to go through this plan first, and it is so successful that oftentimes people do not need to go for their back surgery anymore. Specialist network will also apply when contemplating specialist treatment, and please call into Medshield because we haven't got them published to get the name of the closest specialist in your area. MediSaver is a savings plan, which is pretty obvious from the name, as opposed to a traditional plan. The casualty and maternity new benefits apply to this plan. The over-the-counter or OTC benefit, the daily limit has been removed. Mental health and prostheses for 2025, the benefits apply, as well as interventional radiology and the new specialist network. So nothing too much different from what I've mentioned before. Right, for MediBonus, very much similar types of changes. New casualty emergency, there's 2 visits per family, remember, not a specific time. New maternity related tests and procedures are there. You get 2D, 3D and 4D scans. New pharmacy advised this is the new additions to the chronic meds, which was specifically mentioned at the launch. Acne, allergic rhinitis, Alzheimer's disease, which is really good for some of you, and then calcium supplementation. Over-the-counter pharmacy, removed the script limit for 2025. New prostheses, internal and external, and there's new interventional radiology, the CTCA. And lastly, there's this new specialist network, which you do need to use, otherwise you're going to be penalized. Premium Plus is the most comprehensive Medshield plan and has the same additional benefits into 2025 as the other ones. Let's go through them quickly. Casualty, maternity, medications, OTC from the pharmacy, new prostheses and procedures, devices internal and external, the new CTCA, and then finally the specialist network, which now needs to be used. With your email, you will see the brochure and also this slide where it's the contributions, so you can go look those up. Let's just do a couple of examples on MediSaver. It has a personal savings account of 15%. Adult gets 8,964, and lesser as you get dependents. All right, so let's look at MediValue Prime, where I've got a lot of clients. All right, so there's a day-to-day limit, but it's not a savings account. It will not roll over to the following year. So it's 7,500, sorry, for a main member. And if it's a member plus 2 dependents, it's 9,600. Premium is 2,997, slightly less for the spouse, and 846 for the child. I wasn't sure what this CT angiography was all about, so I did a bit of research. With a more invasive angiogram, which you can see on the right hand side, you can see the vessel narrowing here. Okay, this is the left anterior descending. Now this is more invasive because they put a cannula in, or a device in through your vein, usually in your inguinal area, and it goes into the heart. The advantage of this is that you can go straight on to doing a stent or doing some kind of treatment. On the left hand side is the new one. It's the new computer tomography angiography. Here again you can see the vessels, and here again left anterior descending, which is the most common one to cause death. You can see the plaques, the calcium plaques there, and also you can see a narrowing specifically in this area, or stenosis, and then unfortunately you then have to go, if it's bad enough, go and actually have an angioplasty done. Right, just having a look at some more notes to bear in mind. When in hospital, please ensure that any dietitian, physiotherapist, or occupational therapist are specifically authorized by your attending doctor. Often what happens is they roam the hospital looking for patients that they can treat, but they don't have specific instructions to do so, and those will be from your pocket if that's the case. Over-the-counter medication with restrictions and limits, some have been removed on all plans except for Medicare. Optical services, frames and readers are available to all plans except Medicare. And internal prostheses and major joints are covered from MediPlus upwards, PMB only for MediValue and the lower plans. Contraception is available on all plans with a sliding scale of benefits, so the higher the premium, the more benefit you get. Impacted wisdom teeth in hospital is allowed except for Medicare. Scans on all plans except Medipeeler. But the new CTCA is also available on Medipeeler. Functional nasal surgery, which is normally an excluded procedure, is available on all plans except Medipeeler and Medicurve. Hernia repair, but not Medipeeler and Medicurve. So hernia repair is available, just not these two plans. All right, and please, if you are wondering about any of the other benefits, please take a look at the brochure. So that's it, everyone. Thank you so much for spending this time. Please read through your brochures so that you understand your plans. If you think you need to up or downgrade for 2025, please contact me urgently now so that we can review your plan. Have a blessed rest of 2024. Take care.